In February 2010, federal agents raided a clinic in West Philadelphia. They weren't looking for a murderer. They were looking for illegal prescription drug activity, specifically reports that the clinic was selling opioid prescriptions without proper medical justification. What they found when they walked through the door was something none of them were prepared for. The smell hit them first, then the conditions, the blood-stained equipment, the cats roaming freely through the facility, the untrained, unlicensed staff performing medical procedures, the jars containing the severed feet of babies, preserved in formaldehyde and lined up on shelves. The lead investigator later said he had worked homicide for years. He had never seen anything like what he found in that building. The man who ran that clinic was Dr. Kermit Gosnell. He had been practicing medicine in Philadelphia for decades. He was 69 years old. He was, by many accounts in his community, considered a dedicated doctor who served low-income patients that other physicians wouldn't see. He was also, according to a grand jury report that described his clinic as a house of horrors, a murderer. In 2011, Kermit Gosnell was charged with 8 counts of murder, 7 infants, 1 patient. In 2013, he was convicted of 3 counts of first-degree murder and 1 count of involuntary manslaughter. He is currently serving 3 consecutive life sentences without the possibility of parole. But the story of how he got there and how long it took is what we're here to talk about today. Kermit Gosnell was born in Philadelphia in 1941. He graduated from Jefferson Medical College in 1966. He began practicing medicine in West Philadelphia in the early 1970s, working primarily with low-income and minority communities in an area that was significantly underserved by mainstream healthcare. By many accounts, he was genuinely dedicated in his early career. Former patients described him as caring, accessible, and willing to see patients who couldn't afford care elsewhere. But something changed over time. By the 1990s, his clinic, the Women's Medical Society at 3801 Lancaster Avenue, had begun to deteriorate. Staff with no medical training were performing procedures. Equipment was not being properly sterilized. Patients were being sedated by unlicensed employees. The facility was filthy, and the complaints were piling up. Between 1989 and 2010, the Pennsylvania Department of Health received multiple complaints about Gosnell's clinic. The Pennsylvania State Board of Medicine received complaints. The National Abortion Federation, which had visited the clinic when Gosnell applied for membership, rejected his application and noted serious deficiencies. They did not report him to authorities. In 1996, a patient named Karna Maya Mongar died at Gosnell's clinic following a procedure. She was 41 years old, an immigrant from Bhutan. She had been given repeated doses of sedatives by unlicensed staff and had gone into cardiac arrest. The death was ruled accidental. Gosnell's license was not suspended. The clinic was not shut down. 14 years passed. In those 14 years, Kermit Gosnell continued practicing. The conditions at his clinic continued to deteriorate. The unlicensed staff continued performing procedures. The oversight continued not coming. Then in February 2010, the federal agents walked through the door looking for drug activity and found everything else. The grand jury report that followed, 281 pages, is one of the most harrowing documents in American legal history. It describes in clinical detail what investigators found in that building, what had been happening there, what the evidence showed about the scope of Gosnell's crimes. The grand jury found evidence that Gosnell had routinely performed procedures, and that in multiple cases, the grand jury identified at least 7 infants were born alive and then killed. I will not describe the method here. The grand jury report is publicly available if you wish to read it. What I will tell you is what the grand jury concluded about why this had been allowed to continue for so long. The grand jury's conclusion was unambiguous. The Pennsylvania Department of Health had not inspected Gosnell's clinic in 17 years, not once. Between 1993 and 2010, the clinic was never inspected. This was not an accident. This was policy. The grand jury found that state officials had made a conscious decision to not inspect certain medical providers because of political controversy surrounding that type of clinic. They were afraid that inspections would be seen as attempts to restrict access, so they stopped inspecting all of them. Let me be very clear about what I'm saying and what I'm not saying here. This story is not about politics. This channel does not take political positions, ever. What this story is about is regulatory failure. The same regulatory failure we've documented in the funeral home industry, in the body broker industry, in the pharmaceutical industry. A provider goes unregulated because regulation is politically inconvenient. A bad actor thrives in that unregulated environment. People die. That is the pattern. And it repeated itself here with devastating consequences. The grand jury was explicit. They wrote that Gosnell's clinic was not an outlier. It was the predictable result of a regulatory system that had abdicated its responsibility. 17 years without an inspection. A patient death in 1996 that resulted in no meaningful action. Multiple complaints to multiple agencies over multiple decades that were either ignored or resulted in no follow-up. Kermit Gosnell did not operate in a vacuum. He operated in a system that chose not to look. The trial began in January 2013. Prosecutors presented evidence, including testimony from former staff members, medical records, and the physical evidence recovered during the 2010 raid. Several former employees pleaded guilty to various charges and testified against Gosnell. On May 13, 2013, the jury returned its verdict. Guilty on 3 counts of first-degree murder. Guilty on 1 count of involuntary manslaughter in the death of Karna Maya Mangar. Guilty on hundreds of additional counts. Gosnell was sentenced to 3 consecutive life terms without the possibility of parole. He agreed to waive his right to appeal in exchange for prosecutors taking the death penalty off the table. He is currently incarcerated at a state correctional facility in Pennsylvania. He is 82 years old. The Women's Medical Society at 3801 Lancaster Avenue was demolished in 2015. Here is what I keep coming back to when I think about this case. Kermit Gosnell was not a secret. He had a clinic with a sign on the door on a public street in one of the largest cities in America. He had a medical license issued by the state of Pennsylvania. He had been reported, complained about, and flagged by multiple agencies over more than 2 decades. And for 2 decades, nothing happened. The lesson of Kermit Gosnell is not political. It is about what happens when regulation becomes inconvenient and regulators decide that not looking is easier than looking. It is a lesson that applies to the funeral industry, to the pharmaceutical industry, to the financial industry, to every industry we cover on this channel. The monsters don't hide. They operate in plain sight. in buildings with signs on the doors, with licenses issued by the state. They just need someone to decide not to look. Next week on Coffin Ledger, pill mill doctors, the physicians who prescribed opioids like candy, the towns that were flooded with pills, and the system that let it happen for years. Subscribe. Share this. Every industry has a coffin. We track what killed them. This is Coffin Ledger.